So I would like to introduce you to the 20th presentation, which is Addressing Crisis in Maternity Services in UK, a collaborative approach to safe, respectful care. And I would like to welcome Sheena Byrom. And I would like to introduce her to you, because she is quite an amazing person. She is a practicing midwife for over 40 years, having worked in the NHS for most of the time. She was one of the UK's first consultant midwives, and as head of midwifery, successfully had to lead the development of 3 birth centers in East Lancashire. As well as being an international speaker, Sheena provides workshops and consultancy services on respectful maternity care. With her midwife daughter, Anna, she's the proud joint owner of the Practicing Midwife Journal and an exciting learning online platform, allformaternity.com. Sheena's midwifery memoirs, Catching Babies, is a Sunday Times bestseller, and the seminal book, The Roar Behind the Silence: Why Kindness, Compassion, and Respect Matter in Maternity Care, jointly edited with Sue Dunn, is being used as a resource to improve maternity care throughout the world. Sorry if I bungled the pronunciation of the co-author. In 2019, Sheena and Sue edited their second book, Squaring the Circle, Researching Normal Childbirth in a Technological World. Sheena was awarded an OBE in 2011 for services to midwifery and was made an honorary fellow of the Royal College of Midwives in 2015. In 2016 and 18, Sheena received honorary doctorates from Bournemouth University and the University of Central Lancashire. And in 2017, she was made a visiting fellow at Bournemouth University. Her personal and midwifery-related website is sheenabyrom.com. Sheena is committed to the humanization of childbirth and to supporting the well-being of maternity staff through compassionate, collaborative, and inclusive leadership. Please welcome Sheena, everyone, and enjoy the conference.
Thank you so much.
Over to you.
Thank
you.
Thank you so much. I really appreciate that. It sounds a lot, doesn't it? I'm going to just share my presentation now. Hopefully it will show up and I'll go to full screen like that. So first of all, thank you everybody for joining this evening, joining me this evening. I'm actually in Greece, so it's 2 hours ahead of the UK. So for my friends that are in the United Kingdom, it's later here, but it's great to see you. And then everybody else from around the world, I'm not sure what your time zone is, but it's such a huge pleasure to see you all here. And this presentation that I'm going to give you is on behalf of many people. So it's not my work particularly. I'm just sharing it with you because I think it's really important that you see some activism that's going on in a country that's normally very well resourced and well supported in terms of maternity care. Oh, is it not showing now? Something happened. Wait a moment, let me see if I can get that back on. Something happened to my...
Yeah, we're just on your email at the moment.
Oh, I don't want you to do that.
Just double click on the Sheena PDF 2, maybe.
Sorry. I don't know what's happening here. There we go.
There we go.
Okay,
back on it.
There we go. Thank you. So first of all, I just want to make it clear that because my talk will be in parts quite controversial, but I just wanted to make it absolutely clear that the intention of this presentation and the group that I'm going to be talking about is to support individualized, relational and trauma-informed care whilst respecting physiology. So these two images really kind of reflect that. One is where a woman's had a caesarean section, but physiology is being well supported there with skin-to-skin contact. That's not the anaesthetist giving her a kiss, it's her husband or a partner, and she's cocooned in a little space where there's a real connection that's being supported for the beginning of that journey. And then a home birth or a birth of any other kind where the midwife is supporting the person giving birth. So physiology is kind of, respecting physiology is central to a lot of what I'm going to be talking about. And just to start off, a reminder that in some countries around the world, and many of them will be the countries that you're in, there's too little, too late interventions or resources, so that mothers and babies are dying. And if they're not dying, they're not thriving. And in other countries, the exact opposite is happening, where there's too much intervention. And we know this has been going on for a long time, and it's escalating and escalating year on year. Both issues, both situations are critical. Both are just as important as each other because they're both causing harm or potential harm. I just wanted to let me press OK because I can't see what's on. Yeah, so in England and the rest of the UK, I'm just going to be concentrating on that tonight. I just wanted to highlight that this is an area of the world that this presentation is about this evening. And just to show you that we've got an escalating caesarean section rate. And in fact, it's overtaken America, and it's just really sort of, the trajectory has gone up. It's unbelievable how quickly the caesarean section rate, both emergency and optional caesarean women who are choosing it, is just both risen dramatically. And you can see from this chart that England is the highest. It's gone up. It's the brown mark. It's the brown line, and you can see that it's higher than all others. This is the latest information that we've got, and it's around 44% of women having caesarean section, and that was in 2003. In some maternity units in the United Kingdom right now, around where I live, it's actually 60 to 70% caesarean section rate. So it's really, really worrying. And the rising caesarean section rates not improve mortality. In fact, maternal mortality is increasing for the first time. And it's not necessarily related to this, but we're not improving maternal mortality with this situation, but it's increased morbidity and reduced women's choices. And we have to always reflect back, because very often we hear, especially now in the United Kingdom, we're hearing that, well, it's women and birthing people don't necessarily want to have a physiological birth, but we know from the evidence that that's not true. And certainly with this is the latest evidence showing that 35 studies from 19 countries show that most women want a physiological labour and birth, whilst acknowledging that birth can be unpredictable and scary, and that they want to go with the flow. But if intervention is needed or wanted, that women retain a sense of personal achievement and control through active decision making. And I guess from my perspective as a midwife for many decades, this is exactly what I've seen in practice. So it's reflecting that. We've also got a situation in England at the moment where we've got induction rates where I think it's 1 in 3 women are being induced for various reasons. And so again, you can see that we've got a high level of induction of labour. And when we reflect on the research around that, so women are expressing a desire to avoid induction of labour, along with the intention to resist pressure, allow for more time for spontaneous labour onset, and want to have more knowledge about non-medically indicated justifications. And I think that's the key point here, is information giving and women really understanding the situation when they're and they're being offered or sometimes coerced into induction of labour. So and so there's been various papers written about this, and this is one of them by Professor Sudan in the Conversation. It's open access. You can easily find it. If you Google Sudan, the Conversation caesarean section, you'll find this paper. And in it, she says that although the stillbirth rates have fallen slightly in recent years, rates of both maternal and neonatal deaths have gone up, and the numbers of traumatic birth experiences, which I'll come on to. And given that the reasons for performing caesarean section include reducing mother and baby deaths and birth trauma, it's surprising that higher rates of surgical birth do not seem to be associated with the improvements on a population level. In many of the outcomes, though, these operations do benefit individual women. So what she's saying in this paper is that, yes, some women need them and actually want them, and we have to acknowledge that. And if you know, they're life-saving operations, but what's happening now is so many women are having caesarean sections that the women that really need them, it's sometimes, or really need induction of labour, then it's delayed, the care is delayed, and that's causing even more trauma. So it's really important that if a caesarean is needed, then it's done quickly and efficiently and with the mum in charge. So it's, you know, we're looking at the excessive number of potentially unnecessary operations. So although the media is saying, you'll see that I come into the media shortly, that 1 in 4 women in England give birth via caesarean section, in contrast to the actual rate of more than 2 in 5. So very often we see in the press that 1 in 4 women, but it's actually 2 in 5. It's more than that, and it's going up all the time. And there isn't any indication that this is going to pause or go down at all. And for those women over 40, it's now the most common way for them to be born. This is quite dramatic for England and the United Kingdom. It's a dramatic change that's been happening over the last 10 years. And everybody keeps sort of surmising as to why it's happening. And there are various indications. And so very often what's reported in the press is that women are older now, they're have more complex needs, they're of larger weight, or they're from disadvantaged backgrounds. But yet, when you really look at the data, there is no data to say that. And actually, in fact, the average age of women giving birth, so when you talk about the age of women sort of in the childbirth journey, you can see that the average age only went up from 28 to 29 between 2012 and 2022. So that can't be the reason why caesareans have escalated so high. And obesity rates, again, there isn't that data to say that that's why it's happening. It's just being surmised. And despite similar changes in Europe, such as despite the fact that the age has gone up for the first baby and the rates of obesity and newly diagnosed diabetes, in other countries, the babies, this effect doesn't seem to be happening. In fact, Norway has less than half of the rates of surgical birth than in the UK, with better outcomes. So, but this kind of rhetoric is being pushed out all the time, but starting to be challenged by the professors of midwifery who are looking into it. So other reasons why we can see that these are being sort of suggested as being reasons. So finances meaning that it's quite contradictory really, but finances in that staffing levels are low. And even though the government will tell us that we have got enough staff, there isn't. The midwives on the ground and obstetricians are feeling totally pressurised and burnt out, which I'll come on to. So when you haven't got enough staff, or when staff are feeling fearful and afraid and they're pressured, they're more likely to intervene. And there's the issue of race, of inequalities around with racism and also with gender inequalities too. and the after effects of COVID-19. When you think about the fact that many of our home birth services were paused during COVID, and birth centres, so midwifery-led units, were closed during that time, and many of them haven't been able to recover, and it's caused sort of lasting damage in that respect. And politics, massively. Politics has influenced the way that maternity services are being delivered in the UK, which we'll come on to. So all these issues are impacting on the current situation and the way services are being delivered at the moment. This next slide is showing that there, and many of you will know about this. There's been numerous reports written following reviews of maternity services after there's been harm reported to mothers and babies, harm and actual morbidity and mortality. And there's a sequence of events that have happened, and reports are ongoing. And not only have we had 3 reports in England, there's 2, one in Wales, one in Northern Ireland, and one is starting in Scotland. And there's another 2 ongoing in England, and a large national review as well. So particularly in England, we've had so many reviews, and the recommendations from the reviews they've tried to be implemented within maternity services, but not always successfully. And what we're seeing is that midwives and obstetricians report back to say that there's so many criteria within these recommendations which are essential when you think of trying to reduce morbidity and mortality. There has to be some kind of action taken, but they're so vast, the recommendations, and not being implemented in a way that's doable, because the midwives and obstetricians are reporting feeling like they're constantly being tick boxing, making sure they've ticked boxes rather than supporting and being with the people that they're supposed to be caring for. The reviews have caused a greater workload, which is ironic, really. The other thing that I need to draw your attention to is that some of the reports are that some of the actions that are taken from these reports are causing restrictions on the choices that women are making. So the risk agenda has been highlighted within these, so risk has become even greater, and the fear around that. So of course we have to try to minimize risks, but sometimes not all risk can be, and that risks are different for every individual, how they perceive that risk. But it's the consequences of a lot of the risk management that's happening as a consequence of these reviews are causing the choices that women make are being reduced. So what do maternity staff say following the reviews and following and sort of as a consequence of what's happening in maternity services at the moment? And a senior obstetrician just said she's 11 caesareans on my labour ward day this week. So that was all in one day. None of them were Cat 1 or Cat 2, which is emergency. Many of them maternal requests, some of them straight off, and some of them partway through the induction process. And she feels that the maternity world is becoming unrecognisable. A senior midwifery leader said, I don't feel that the NHS or universities are able or prepared to support midwives for NHS care. The governance structures are based on blame, which negatively impacts on midwives' well-being. They can't be the midwives they would like to be because there is fear of repercussion. And a doula said that, who's speaking to women a lot during her work, she said what might feel like a warm water of safety has lulled a lot of people into a false sense of security. She's simultaneously bored and traumatized listening to the same horror stories over and over again, seeing the same shameful statistics and watching maternity care crumble. This is a doula of 20 years. And what do mothers say? They're just constantly bombarded with risks. And I was talking to a midwifery I was talking to a birth educator who was a midwife, is now a birth educator, said that the women that she sees are just constantly bombarded with risks, and that their doors, it's almost like doors are closed every time they go to an appointment with their midwife or doctor. And this person feels like it's overwhelming. It's almost impossible to get to 40 weeks without having any sweeps, inductions, very difficult conversations with consultants. There's so much pressure to avoid all risks, meaning our choices are taken away. And I have to say that when I've spoken to consultant obstetricians, they're in a difficult place too, because they're working on the basis of making sure that they're providing all the information, but they're fearful too of the repercussions which have been happening over and over again in England. This is a really important paper that's just been recently published, showing that actually the reviews that have been carried out have missed a trick in that they haven't really taken into consideration racial inequities. And so the absence of intersectional analysis of the investigations has constrained their capacity to address the structural drivers of poor outcomes. So this has been missed off out of the reviews, and it's important that I mention that, because these reviews have sort of been widely implemented, and yet this is Black women in the UK face 3 times the risk of maternal mortality compared with white women. And so, really important issue to address. So the consequences of what I've been talking about, that Saving Babies' Lives Care Bundle came out as a result of the reviews. And what we're seeing is more women requiring serial scans and early induction of labour, leading to huge delays. Because if you imagine, it's like a bottleneck. So when so many women are being induced with the same resources that there were before those women were being induced, or even less because midwives are leaving, which I'll come on to, the delays are massive. And so you can get a situation where a woman is told that her baby's at risk, and she's admitted for induction of labour, and yet it doesn't happen for several days as there's so many women being induced. And this director of midwifery said, and this is anecdotal obviously, we're seeing an increase in morbidity and postpartum hemorrhage. Birth trauma is a big topic at the moment in the UK, quite rightly. Women are feeling traumatised by their experiences and feeling like they're going through a process where their choices are being limited, and also the treatment that they're receiving is not compassionate and not respectful in their eyes, and they're feeling totally disenfranchised. And so 45% of women in one study are reporting birth trauma. And Claire Feeley et al. Said that as got a paper coming out to say that a recent survey found that 38% self-reported birth or perinatal trauma, and 17% reported obstetric violence. So what's happening currently is that so women are choosing to have a caesarean, or if they don't fit the sort of mold for going down the route of what they're being sort of moved into the sort of inverted commas, the system of maternity care, and they don't want that, so they want to have more control over their birth experience. They're fearful of going and having an induction of labour, or having sort of the general maternity care. Women who are fearful of that are either choosing to have more control by having a caesarean section, a planned caesarean, or other women are choosing to have a free birth. And this is happening in the UK as well as this report is from America. But, it's happening in our country too. And what about the staff? So report after report, and we're seeing it constantly online. Midwives and student midwives are feeling burnt out, they're leaving. They're talking about moral injury, where they're not able to deliver the care that they've been trained to give. and they're not practicing midwifery. More and more midwives are saying they're more like obstetric nurses. Student midwives are saying that they have more experience in theatre than they do supporting women through any kind of vaginal birth, let alone physiological birth. And this review that was this study that was done by Claire Feeley and Thomasina Stacey, midwifery practice students said midwifery practice has become defensive. We've lost the instinct and the art of midwifery. We do lots of testing and ticking boxes in order to improve outcomes, which is not always the case. Key elements of the role are now excellent computer skills, excellent record keeping, rather than excellent listening skills and passion for pregnancy, birth and beyond people and communication skills. So this is looking into why midwives' intention to leave. And what about student midwives? Again, Claire Feeley et al. Has looked at a cross-sectional study of 3,055 births during 2020 and 23 in England, looking at student midwives' exposure to physiological birth, and finding that the students had extensive experience within obstetric units and with medicalised care practices, but less consistent exposure to midwifery-led practices. And without that exposure to midwife-led birth practices across all settings, students qualify without the necessary experience to build their competency to optimise physiological birth processes, which is part of the NMC standards, raising concerns for their preceptor period and beyond. And student midwives, again, have been targeted, well, the universities have, from a group of people who have instigated media reporting that student midwives are being taught too much about physiological birth and not around other things that they really need to be taught about, and that normal birth has become the problem, inverted commas, normal birth, and it's being called an ideology. So there's criticism, even though we've got the picture that student midwives aren't seeing physiological birth. The exact opposite is being reported by the news, the media, and the media has a big influence on what's going on at the moment in the United Kingdom. So what we did and what we're doing, a group and other maternity researchers met just by chance, and we were talking about the frustrations that we were feeling in April 2025. And we felt, there were two things that we wanted to address. One thing, we wanted to use our skills and our knowledge to try to influence a way forward. And the second thing was that we wanted to give some hope, because the elephant in the room wasn't being addressed. So nobody at all, apart from criticism, was there any sort of outward kind of discussion around the fact that the normal birth rate, the physiological birth rate, was declining massively, caesarean section rates increasing exponentially, and women were becoming more and more disenfranchised with using maternity services. So that wasn't being talked about at all. And so we felt that we wanted to give some hope to the people who are working in maternity services to say, you are being heard and we're listening, and we can maybe hopefully do something to help and to give you some solace. So this is what we did. We set up a midwifery and maternity birth collective, a movement aiming to bring together clinical research, expertise and lived experience to analyse contributing factors and to contribute to collaborative partnerships that promote safe, respectful and evidence-based care. Above all, we hope this movement will offer solidarity, clear information and a sense of hope to everyone working in using or supporting maternity services. And these are some of the core group. So we have a core group, but we have a lot more people involved. But these are the individuals, and one of them is Molly, who's with us tonight. And you can see that we've got a range of obstetricians, midwives, student midwives, and mothers involved, and we've got charities as well. And everybody's welcome. This isn't a sort of elite group of people. This is just, we just do this all in our own time, and There is no payment, no receipt of anything. We just do it because we believe in it. But everybody's welcome. It's an open door, and we're grateful to anybody that wants to join us to help us, because sometimes it can be a bit overfacing doing this on top of everything else. So political pressure that we've been getting involved in and putting ourselves in the middle of is sort of connecting with MPs as much as possible. And we do this in a variety of ways, because we've all got sort of individual connections, all the group and the wider group as well. So the left-hand photograph was actually Maya Ellis. Their name's spelt wrong there. It's Maya Ellis. She's just given a talk, a short talk in Parliament about the situation based on what we've been doing. Future Midwives protests, we've got a ridiculous situation in England where we've got student midwives who are qualifying very soon, and some that were qualified last year who haven't got jobs. There's hundreds of them without jobs, yet they're needed on the shop floor. They're desperately needed. So financially, the trust, the organisations, Maternity Services, aren't employing midwives because of financial constraints, yet there are students desperate to work. And then on the right-hand side is the Make Birth Better Collective. That's a fantastic charity that works to improve birth. And we have been involved in that. So myself and others have been part of that group too. We actually went to Westminster and presented to our health minister on the issues that were sort of, it's actually the group, this particular group is made up of more than 90 organisations and individuals who brought together from the ground up what the issues were, and we presented them in a report to the health minister, and also to a woman called Baroness Amos, who's leading the national review of maternity services. And there's another meeting to be held in June again with more of that group. So there are things happening, and there is political pressure being put on politicians. So what we do within the group, just to make it active, is we have a newsletter, and the newsletter is produced once a month. And actually I do that newsletter, and I'm always looking for somebody to help me, but I do it at the moment. And there are 777 people that receive this newsletter. And what we do in that, you can actually scan that now and join if you like. But what we do is we put things in the newsletter that we feel that will be helpful. So any reports that are coming out, any information from politicians, any support groups, new papers that have been released, and also to introduce any events that we've got coming up, like conferences, for example. We've had some online seminars. We need to have more, but again, it's time. But these seminars try to address some of the issues that we're facing at the moment, and they're all free to access. And then we communicate via social media. So there's a midwife called Leah Hazard who's been very active she's part of the core group. She's been very active in working time directives, because midwives are working too many hours, and that's causing lots and lots of problems. Of course, midwives are burnt out, which I said at the beginning. So they're leaving because of this. So she's really taken on board that. And so have the Royal College of Midwives. And then the future midwives that are the ones that are the student midwives who are trying to get the more placement, more jobs, and they're also wanting to abolish any costs. So student midwives in England have to pay university fees to train. They're coming out with huge debts, and then they've got no job at the end of it. And then, of course, the Practicing Midwife Journal, of which me and my daughter own, all for maternity. So we do a lot of the activism on there, and Molly does as well, who's with us tonight, biomechanics for birth. So we communicate via WhatsApp. We have a WhatsApp group, and we also have a Padlet where we share our expertise on there, all the core group, and we make suggestions on there too for the future, for any seminars and any help that's needed. So we have really sort of efficient ways of communicating. And I have to say the WhatsApp group has been absolutely brilliant and key to us moving things forward. So the future, come to the end now, the future is, this is what we want really. We, this beautiful poster that Sudan made once is really just summing it all up. We want women and birthing people to have a good outcome and for them and their babies. And we want it to be right for both the present and the future, because the consequences of what's happening isn't just the issues that are, isn't just the impact now, but it's for the future health of the mothers and babies as well. And we want both medical care and support for physiology, and both honesty and a recognition of complexity. So thank you so much for joining me this evening, and I'll just take that off and stop sharing. Has anybody got any questions? It's gone dark here. Thanks, everyone.
Thank you so much, Sheena. Beautiful presentation, even though the situation is really sad and it's happening in many countries, unfortunately.
It is. Can I add there? Yes, I should have mentioned that. It is. I know that it's happening in many countries. And I think what I probably missed saying at the beginning is I acknowledge that, and I'm in contact with many midwives from around the world. But what's really quite sort of it's highlighting for us is that it's never, well, it has been sort of coming for 10 years, as I said, but we've always had a situation where we've had midwives who are highly respected and trying to, feeling very proud of their job, their roles, but at the moment they're feeling afraid to say that they're midwives because of the negative press. There's so much negativity in the press, and so we've got midwives who are saying they daren't say, for example, at parties that they're a midwife because there's so much of that going on. So the media has had a huge part to play, and interestingly, the media seems to be influencing the way maternity care is delivered and the way that the policy is being planned. So has anybody got any comments? I can see that I've got some colleagues and friends in the audience who may want to add to what I've already said.
Yes, Kate was just asking about that. If you think social media has had an impact, and she says that she's surprised by the increased anxiety during pregnancy, and she spends a large amount of time trying to dispel myths when she's going antenatal education for women and families, and trying to help women and birthing people to tune into their own bodies and intuition without much success. And she really feels it's an issue in wider society too. Often we do not like uncertainty, and we feel we are opting for a guarantee when choosing caesarean, and it's so sad.
I think, yeah, I agree. And it's great that we have to have a childbirth education as long as it's coming from a reliable source. And but the worry is that the women can be armed with the best knowledge and information, and then they go into the maternity unit, and all that kind of it's not supported. So it's a huge challenge, really. And midwives and obstetricians, in many cases, are really trying. They're going to work to do their best and to try to make sure that women and birthing people's choices are acknowledged. But they're so short of time. So, for example, with induction of labour, giving the information that people need to make an informed choice and to make a true informed choice, there doesn't seem to be the time to give that information and to make sure that it's evidence-based and non-biased.
Yeah. Healthy as a question, and then we were going to have to wrap it up, unfortunately. Okay, let me
Hi, Elsie. Can Elsie not speak?
Yes,
Yes,
Elsie has a
I'm going.
question. Yeah.
Hi, Elsie.
Go ahead, Elsie.
Oh, hi. Sorry. Trying to unmute. Hi, Sheena. Thank you so much for that presentation, very frank presentation. My question is about the litigation versus the costs for provision of the service. How is that panning out now?
Yeah, that's a really good question. And of course, I didn't cover everything in this short time, but that is huge. And yeah, so it's actually costing more in litigation payments than it is to deliver maternity care. And that's a scandal, really. So one of the, it depends how you look at it. I believe that we should have no fault compensation, and that would take away the fear, but it would also, well, potentially take away the fear that's going on, that's sort of ingrained at the moment, but also it would support the families that really need support, because if the harm has been done to someone, they do need support. So I think, I mean, that was actually proposed in the policy Better Birth, if you remember, 10 years ago. That was one of the recommendations in that policy. But of course, it didn't come to fruition.
Thanks, Sheena.
Has that answered your question, Elsie?
It has. I just wondered about that, really. Yeah, thank you.
Thank you so much. Unfortunately, we have to wrap it up, but yeah,
Ellie,
it's
can
a
I
bit.
ask a question?
Sure.
Of course.
Hello, Sheena. Thank you very much for this presentation. This is very insightful. There is one thing I wanted to find out. What is informing the demand of CS? You mentioned that mothers are saying induction and sweeps, and some were also related to the traumas. I want to find out, have we also delved into the situation? Have we found anything concerning the midwives? Do we have some gaps identified, being it knowledge, attitude, or anything? Have we done something like that? Thank you.
Sorry, Betty, what was your actual question? You want to know why women are choosing cesarean? Is that what you're asking me?
Yes, they are saying their concern was about the induction, the sweeps, the trauma, and that is why they are chasing the cesarean sections, if I'm right.
Yeah. Yes, yeah. So, yeah, just to explain as well a little bit of the backstory. So, in England at the moment, you can choose to have a cesarean, and it's all on the National Health Service. So, you don't pay for anything, it's free. So, you can actually go and have a major operation to have your baby. And I have to say that for some women, that's really, really important, because they may have some previous trauma from their lives that make them want to have sort of, it might be something that's happened to them during their early life that kind of, excuse me, that leads them to that decision. And that's
Very
that's really important. But some women are saying that they want to have a cesarean because they don't want to go through having a vaginal birth, especially with an induction of labor. They think it's less traumatic to have more control over, when you're going to go in, you can go and sort of have the operation when you want it, as long as the doctor's available, and it's all straightforward. So that's and you can choose that at the moment. You didn't used to be able to in the United Kingdom. Well, in England, you used to have to go through a process of seeing two doctors before, and it wasn't sort of always guaranteed. But more or less now you can choose that. But I have to add that what's so sad is that, yeah, that's right, if women want to choose that, but you can't choose to have a physiological birth, because you can say that you want that, but it's probably not going to happen if you have your baby in hospital. Not always, not always, but on the whole, you're very unlikely to have a true physiological birth. So you can choose to have an expensive birth, and this is no judgment on anybody that chooses to have a caesarean birth. I am not making any judgment. Like I said right at the beginning, it's so important, choice and also respecting physiology. But what I am saying is that there's a real kind of contradiction here, that you can't have something that is more healthy for you and your baby and costs less money. That probably won't happen.
Thank you.
Thank you for your question.
Could I just can I say something just at the very end?
Yes,
is that okay?
Very quickly.
Just very quickly.
Very quickly.
Sheena, that was absolutely incredible. You covered such a lot there, and it's a very complex subject. But one of the issues that we have is a vilification of midwives in the press, in the media, and this is harming the trust. And you mentioned trust. Trust is so important, and so women are now choosing these other ways to stay in control of their situation and decrease their fear, which would be either not using this, getting involved in the system at all and free birthing, or choosing a caesarean. But what we have got is a narrative that's pushing the risk narrative very far, to the point where physiological birth is in itself demonized as being highly risky, and home birth as highly risky, where you could die. That kind of narrative accompanies that. Yet we don't have a similar narrative with major abdominal surgery, which increases risks as well for future pregnancies, including placenta accreta and preterm births if it's done in a late stage of the birth process. So everything has risks, but it's very one-sided in the media, and that's a challenge that we're looking at, isn't it, Sheena? This imbalance is an imbalance. We just want balance. That's the main focus, really, is having balanced discussion. But at the minute, midwives have been cut out of that conversation. That's all I wanted to say.